Hi, good day everyone. You're welcome to my YouTube channel, Everything Medical. On today's video, I'll be treating the anatomy of the anterior cranial fossa. Before we proceed to the class deeply, we are going to be giving a little bit overview of the cranial cavity. Recall that the cranial cavity is divided into three depressions or into three fossae: the anterior cranial fossa, the posterior cranial fossa, and the middle cranial fossa. But our focus on this class is the anterior cranial fossa. Each of these fossae lodges different part of the brain. It lodges different part of the brain. So we are going to be going into the class deeply. The first thing to note is the introduction. The introduction. What is anterior cranial fossa? This diagram depicts the anterior cranial fossa. Anterior cranial fossa is the most shallow and the superiormost part of all the three fossae we have in the cranial cavity or the base of the skull. What does it do? It lodges the anterior inferior part of the frontal lobe of the brain. It lodges the anterior inferior portion of the frontal lobe of the brain. That is what it lodges. Recall that the anterior cranial fossa is superiorly to the nasal cavity and the orbital cavity. That is the nasal cavity and the orbital cavity. The nasal is for the nose, while the orbital is for the eye. That is the concept of the anterior cranial fossa. Up to the next we'll be discussing is the formation of the anterior cranial fossa, the bony formation. The formation. What are those bony structures that forms the anterior cranial fossa? As you can see on this diagram, you have three bony structures here. Number one is the frontal bone, and here is the frontal bone. Frontal bone. Number two is the ethmoid bone, and here is the ethmoid bone. Ethmoid bone. Number three is the anterior aspect of the body of the lesser wing of the sphenoid. That is the lesser wing of the sphenoid, but its anterior aspect. Here is the lesser wing of the sphenoid. The lesser wing of sphenoid, particularly its anterior aspect of the body that forms the anterior cranial fossa. So we have three bony formations: the ethmoid bone, the frontal bone, and the lesser wing of the sphenoid. That is it. The next outline that we're looking on to is the demarcation, because the anterior cranial fossa is being demarcated from the middle cranial fossa by a bony feature. The bony demarcation. The demarcation between the anterior cranial fossa and the middle cranial fossa is not just a landmark. It is a very, very important structure or a very, very important bony landmark that forms it. Number one demarcation is the posterior free border of the lesser wing of the sphenoid. The demarcation is two. Number one is posterior free border of the lesser wing of the sphenoid. That is the number one bony structure that forms the demarcation. Now, number two is the anterior border of the sulcus chiasmaticus or the prechiasmaticus sulcus on its median plane. So the anterior border of the sulcus chiasmaticus on its median plane or on the midline region, because this is the structure of the anterior cranial fossa. This is the median plane, and here are the lateral planes. So we have two planes. That is what we'll be discussing on the features. The median plane or the median region, and here is the lateral region. Okay, so these are the two bony demarcations of the anterior cranial fossa. As we proceed, we'll be discussing them one by one. But between these two demarcations, at the junction between them is marked by an anterior glenoid process. Between them is marked by a bony projection known as the anterior glenoid process. So here is the anterior glenoid process. It's a junction that marked the demarcation between the posterior free border of the lesser wing of the sphenoid and the anterior border of the sulcus chiasmaticus on its median plane. Because that I said previously that here forms the median plane of the anterior cranial fossa, while this side on my both side forms the lateral plane. Up next we'll be discussing is the boundaries of the anterior cranial fossa. The boundaries. The boundaries. The boundaries. The boundaries of the anterior cranial fossa are as follows. Number one is the anterolateral boundary. Anterolateral boundary. Number two is the posteromedial boundary. Number three is the posterolateral boundary. While number four is the floor. Anterolaterally, the anterior cranial fossa is bounded by the inner surface of the frontal bone. It is bounded by the inner surface of the frontal bone. That is the anterolateral boundary. Bounded by the inner surface of the frontal bone. I discussed the anterolateral boundary. Posteromedial boundary is bounded by the limbus of the sphenoid bone. The limbus of the lesser wing of the sphenoid. The limbus is a prominent bony ridge that forms the anterior border of the sulcus chiasmaticus. What is the sulcus chiasmaticus? Sulcus chiasmaticus is a groove that runs between the right and left optic canal in the middle cranial fossa. As you can see here, this is the optic canal, the left and right optic canal. As you can see here, this is the optic canal. So here is the limbus. Limbus is located on this region. It is a what? It is a prominent bony ridge that forms the anterior border of the sulcus chiasmaticus. Recall that the sulcus chiasmaticus overlies this region. It's a groove that runs between the left and right optic canal. When you check the middle cranial fossa superiorly, you could see the optic canal that transmits the what? Optic nerve. That is how it goes. So that is what that forms the posterior medial boundary. Now, the posterior lateral boundary is formed by the lesser wing of the sphenoid. It's formed by the lesser wing of the sphenoid. Okay, the floor of the anterior cranial fossa is formed by three bones, which I've discussed earlier. It's formed by the frontal bone, particularly the orbital plate of the frontal bone. It is formed by the ethmoid bone. It is formed by the anterior aspect of the body of the lesser wing of the sphenoid. That is what that forms the floor. Three bony structures that forms the floor of the anterior cranial fossa. Up the next we'll be discussing again is the features of the anterior cranial fossa. the features of the anterior cranial fossa. The features of the anterior cranial fossa. Anterior cranial fossa has so many features. The features are being divided into two: the median plane feature and the lateral region feature, or the median region feature and the lateral region feature. So we have the median region feature and lateral region feature. We are going to start with the median region feature. The median region feature The first feature on the median region is the frontal air sinuses. The frontal air sinuses. We have the frontal air sinuses. As you can see here, this is the frontal air sinuses. The frontal air sinuses. Another one is the frontal crest. What is the frontal crest? The frontal crest is a prominent bony crest or a vertical bony crest that is found on the frontal bone. It provides site of attachment of the vas cerebri. Vas cerebri is a sheet of dura mater. It's a sheet of dura mater that separates the cerebral hemispheres. So the first, or the very, very important bony projection of the frontal bone is the frontal crest, which is a vertical bony projection, a vertical bony crest that provides site of attachment of the sheet of the dura mater that separates the cerebral hemispheres into two, known as the vas cerebri. Here is the frontal crest. Frontal crest. The next one is the foramen caecum. The foramen caecum. The foramen caecum. The foramen caecum is a canal that transmits the emissary vein, because the emissary vein leaves the nasal cavity to communicate with the superior sagittal sinuses on the cranial cavity. So it provides a passageway for the emissary vein, and that have a clinical anatomy, because fracture of the anterior cranial fossa could lead to the damage of the emissary vein. And recall that the foramen caecum is a canal in which the emissary vein leaves the nasal cavity to communicate to the cranial cavity by anastomosing with the superior sagittal sinuses. So any infection to the nasal cavity can spread to the anterior cranial fossa through the foramen caecum. So it transmits the emissary vein. Emissary vein. What it transmits. So here is the foramen caecum. Foramen caecum is just found between the frontal crest and the next bony feature that we'll be discussing, which is the cribriform plate of the ethmoid bone, or again the crystal galley. So it's found between the frontal crest and the cribriform plate of the ethmoid bone, apart from the crystal galley. So the next feature we'll be discussing is the crystal galley of ethmoid bone. The crystal galley. The crystal galley is a cork comb-like bony projection. Is a cork comb-like bony crest or a projection. A cork cox cox comb like bony crest. It is a cox comb like bony crest that is found on the floor of the anterior cranial fossa. It as well provides site of attachment of the fast cerebri. Okay. On the both sides of the crystal galley is the cribriform plate of the ethmoid bone or the perpendicular plate of the ethmoid bone. Here is the crystal galley. The crystal galley is a cox comb like bony crest that is found in the middle of the perpendicular plate of the ethmoid bone or the cribriform plate of the ethmoid bone. So our next bony feature is the cribriform plate of the ethmoid bone. The cribriform plate of ethmoid bone is a very, very important bone. We call it a sieve-like cribriform plate of ethmoid bone. It is found on the both sides of the crystal galley. It has so many foramen. It has so many small foramens that transmit structures that communicate the cranial cavity and the nasal cavity as well. The first foramen it has is the cribriform foramen or the nasal slit. The cribriform foramen that transmits the olfactory nerve. We have the cribriform foramen. The cribriform foramen. Here is the cribriform foramen or the nasal slit. The cribriform foramen transmits the olfactory nerve. It transmits the what? Olfactory nerve, because the olfactory nerve leaves the olfactory epithelium in the nasal cavity to communicate to the olfactory bulb in the cranial cavity by passing through the cribriform foramen or the nasal slit. So it's a very, very important foramen because any fracture to the cribriform plate of the ethmoid bone will lead to the what? Loss of sense of smell. That is anosmia. You get? So it's a clinical anatomy that is associated with the fracture of the cribriform plate of the ethmoid bone. So the next thing we'll be discussing is another foramen that is found on the same perpendicular plate of the ethmoid bone. That is the cribriform plate of the ethmoid bone. We have the next one. Recall that the cribriform foramen transmits the what? Olfactory nerve, which is for the nerve that conducts sense of smelling. The next one is the anterior and posterior ethmoidal foramen. Here is the anterior ethmoidal foramen. Here is the posterior ethmoidal foramen. So we have the anterior and posterior ethmoidal foramen. They transmit vessels and nerves. Okay? The anterior ethmoidal foramen transmits the anterior ethmoidal artery, which is a branch of the ophthalmic artery. anterior ethmoidal artery, one, which is a branch of the what? Ophthalmic artery. Number two, it transmits anterior ethmoidal nerve, which is a branch of the nasociliary nerve. Anterior ethmoidal nerve is a branch of the nasociliary nerve. It transmits number three, which is the anterior ethmoidal vein, which is a tributary of the ophthalmic vein. Then, the posterior ethmoidal foramen transmit the following. The posterior ethmoidal foramen transmits the posterior ethmoidal artery, which is a branch of the ophthalmic artery. Posterior ethmoidal artery, which is a branch of the ophthalmic artery. Number two, it transmits the posterior ethmoidal vein, which is a tributary of the ophthalmic vein. Posterior ethmoidal vein is a branch of the a tributary of the ophthalmic vein. Number three, it transmits the posterior ethmoidal nerve, which is a branch of the nasociliary nerve. Posterior ethmoidal nerve. So these are the contents of the foramen that is found on the cribriform plate of the ethmoid bone, or the pendicular plate of the ethmoid bone. So up the next we'll be discussing is the lateral region, because we have discussed the median region. The lateral region. Lateral region. Lateral region. The lateral region is formed by the orbital plate of the frontal bone. Here is the orbital plate of the frontal bone. On the both sides, orbital plates of the frontal bone. Orbital plates of the frontal bone forms the lateral region, because the orbital plate of the frontal bone separates the anterior cranial fossa from the orbit. It as well supports the frontal lobe of the brain from the compressions of the sulcus and gyrus. So it separates the anterior cranial fossa from the orbit and supports the frontal lobe of the brain from the compressions of the gyrus and sulcus. That is the work of it. So it is being formed by the orbital plate of the frontal bone. Orbital plate of frontal bone. Recall that the cribriform plate of the ethmoid bone separates the anterior cranial fossa from the nasal cavity. Yes, exactly. The cribriform plate of the ethmoid bone separates the anterior cranial fossa from the nasal cavity. Recall that the anterior cranial fossa is superior to the nasal cavity, while the nasal cavity is inferior to the anterior cranial fossa. Yes, that was a high yield. The next thing we're discussing is the clinical correlation. The clinical correlation. The clinical correlation. Number one clinical correlation is the fracture of the anterior cranial fossa, particularly the cribriform plate of ethmoid. Fracture. The cribriform plate of ethmoid is the most susceptible bony region of the anterior cranial fossa that is prone to fracture. And fracture of the cribriform plate of the ethmoid bone will lead to two conditions. Number one is anosmia. Number two is CSF rhinorrhea. Fracture of the cribriform plate of ethmoid bone will lead to number one, anosmia, which is a loss of sense of smell. Number two is CSF rhinorrhea, which is a cerebrospinal fluid rhinorrhea. CSF rhinorrhea, because the cribriform plate of ethmoid bone transmits the what? The olfactory nerve from the cribriform foramen. So fracture to it will cause lesion to the what? Olfactory nerve, which will lead to derangement in conducting smelling sensation, because the olfactory nerve has been deranged or has been lesioned. Then the second one is cerebrospinal fluid rhinorrhea, because fracture of the cribriform plate or the anterior cranial cavity will lead to the tearing of the meninges, because when the meninges tear, the CSF will start leaking. It will cause leakage of the cerebrospinal fluid, which will drain into the what? The nasal cavity, causing CSF rhinorrhea. That is the clinical condition associated with the anterior cranial fossa. The next one is about the foramen secum. That is, fracture to the anterior cranial fossa could as well lead to the lesion of the emissary vein that passes through the foramen secum. And again is that the emissary vein passes through the foramen secum, yes, but the foramen secum is a canal that connects the nasal cavity as well and the anterior cranial fossa. So infection to the nasal cavity can lead to the anterior cranial fossa because there's an opening there. The infection can still flow through that region. So the next one is infection to the anterior cranial fossa through the foramen secum. Infection through the foramen secum. Through the foramen secum. So we have done justice to the anterior cranial fossa. We have discussed everything about this anterior cranial fossa. Because that here remains the limbus of the lesser wing sphenoid. Limbus. We have done justice to this bony structure. I hope you understood the class properly. If you have any question, comment it on the comment section. And I hope you understood the class properly. You can share this video to the students in medical school. Thank you for staying to the end of this class. Thank you so much for watching.